Hello, everyone. This is Dr. Carl Hansen. Today, we're going to talk about what to do during this fall, winter, or any sort of cold and cough season. So, what is a cold? A cold is typically a virus that gets into your upper respiratory, nasal, throat passages and causes inflammation. Now, the typical viruses that would do that would be adenovirus, rhinovirus, coronavirus, and there are some others, plenty others actually. Generally, these things are self-limited and you do nothing about them. So, if your symptoms are as follows: runny nose, sneezing, watery eyes, postnasal drip, cough, feeling just yuck in general, maybe some aches, maybe a mild temperature, and maybe some sinus pressure in the head. That typically constitutes an upper respiratory viral syndrome and really does not require any specific attention. What the over-the-counter products that can be taken that some people think helps, the decongestants, the mucolytics, the cough suppressants, they do help sometimes. I don't find much benefit in the decongestants. I do find some benefit in the guaifenesin dextromethorphan products. That would be the Robitussin DM products that do help with some of the cough, or if you have a lot of thick mucus, the guaifenesin component helps thin that mucus. In general, most of these things don't require a lot of antipyretics such as aspirin or Tylenol. They just cause some symptomatic congestion. They typically peak at 5 days, and then they just start to get better on their own, although their symptoms can last even up to, let's say, 10 days. Now, how do you know if you actually have a bacterial sinus infection? Right, the one that people often insist that they need antibiotics for. The bacterial sinusitis infection would be, let's say you're day 6 into this illness and you still have a fever. That would indicate a bacterial superinfection, maybe on top of the original cold. Let's say that you get better, but then get worse again. We call that double sickening. That could also indicate a bacterial infection. What about if you had bloody nasal discharge? If it's just green or brown, that really doesn't mean anything. If there's blood in the nasal discharge, then that also tends to suggest a bacterial infection is more likely to be on board. If you have intense unilateral facial pressure, as if your sinus cavity is just completely blocked up, if there's pain in a sinus cavity, ditto. That tends to suggest a greater chance of actually having a bacterial infection. Doesn't mean you do, but the folks who don't have those extra symptoms really rarely have anything besides just a viral self-limiting upper respiratory infection. When should you call your doctor? If you have any of those conditions, greater than 7 days, bloody nasal discharge, unilateral facial pain, double sickening, that is getting better than worse, if you're having worsening of those symptoms, then you should probably get a hold of your physician. A little bit different caveat. Let's go back to the first scenario, however, where people are just talking about the runny nose, sniffing, coughing, etc. Well, one of the viruses we concerned ourselves with is influenza. General definition of that is the abrupt onset of aches, cough, and high fever. Invariably, you'll have a pretty substantial cough with it. So, influenza. Some people say, well, influenza, shouldn't you know, because you would take a medicine called Tamiflu as a brand name. Tamiflu, I've mentioned this before, has little to no impact. I'm not a big fan of Tamiflu, and it's often frequently given at offices and urgent cares and all that, but I don't feel that it actually has really any benefit. The studies show that it's less than 12 hours worth of change of the illness. Never been proven to prevent anything serious. Now, the other virus that's a little different than maybe I first covered this years ago was coronavirus. Coronavirus, as of 2024, the end of 2024, has become sort of a tame virus, which doesn't really cause much ruckus. Doesn't cause the stuff we saw 3 and 4 years ago. However, there are some people that you may consider susceptible to it. If you're getting the runny nose, sneezing, cough, sore throat stuff, and let's say you've been around with somebody who's had coronavirus, if you're getting that, go back to my other video from this month, which discussed the nasal wash and the gargle solutions to ameliorate or attenuate this illness. But you could do a home COVID test. It varies to a certain degree, but you would call your physician if you came back with a positive COVID test. Then you and your physician can discuss whether or not to embark on early treatment. I'll refer you to my previous videos on what to do for early treatment of a COVID illness or COVID-like illness. But for example, if you came down with a really bad cold, let's say, and you were around two people that had COVID, and you contact me, I'm not likely necessarily to say you need to get a test. I'll say you've been in close contact with a person with known diagnosis, so maybe let's just treat you anyway, even without doing a test. So that'll be a judgment between you and your physician. To recap, number one, most cold viruses, runny nose, green snot, congested sinuses do not need to be called to your physician's attention. These are self-limiting upper respiratory viruses and essentially do not require any medical treatment. There are some caveats in that there is a certain specific treatment I do use for influenza. Again, consult your physician for that. There are certain things that I do to specifically treat COVID. Again, consult your physician for that. And I think most of my viewers know my treatment protocols for those. The other viruses, cold viruses that run their course, you do contact your physician if you do have these other index symptoms that increase your likelihood that your symptoms are that of a bacterial secondary infection of the sinuses. And then you and your physician can discuss how to best treat that. You get a cough, cold, congestion, no need to panic. You don't need to call your doctor in 2 days and say, I got a runny nose, I need to catch this before it turns into something. Just injudicious use of antibiotics for every virus doesn't have any perceivable benefit and likely would cause harm. So that for the most part, you run the course. If you're having contact with somebody with COVID, then you can discuss with your physician about what their treatment might be. All right. Thank you again for listening, and I hope you don't catch anything. And ways to prevent this is also on a video from this month discussing how to prevent these illnesses from setting hold or getting worse. All right. Thank you for listening. Bye now.